Level 1. $0, uninsured. You feel it on a Sunday. A pain that doesn't belong, low and steady, the kind that makes you go quiet at dinner. You don't go in. Not because it isn't bad, because the door has a price, and you don't know the number. And not knowing the number is scarier than the pain. You wait. You drink water. You tell yourself it's nothing, the way people tell themselves things when the truth is expensive. By Thursday it's worse, and the only door left open to you is the most expensive one in the building. The emergency room, the place you go when you had nowhere cheaper to go first. They treat you. That part works. And then, 3 weeks later, an envelope arrives, and the number inside it doesn't look like a price. It looks like a typo. Here's the part nobody explains at the desk. That number is the sticker price, the full list rate that almost no one actually pays. The insurance companies negotiated theirs down years ago. The person who was in the bed next to you with a card in their wallet was charged a fraction of what you were for the exact same hour in the exact same room. You had the least, so you were charged the most. Not by accident, by design. The bill doesn't just sit there either. When you can't pay it, it moves. It becomes a call, then a letter, then a mark on your credit that follows you into every future loan, every apartment application, every rate you'll ever be quoted. The illness ended months ago. The financial version of it is still spreading. They send you home with a follow-up and a prescription, and you fold both into your pocket and quietly decide which one you can't afford. The follow-up gets skipped. The refill gets stretched, half a dose to make it last. Not because you don't understand it matters, because the shelf between you and it has a price tag, and the price tag wins. At 0, the system doesn't refuse to treat you. It treats you, and then it hands you the one bill nobody else in the building had to pay. Level 2. $40,000 a year. You have insurance now, a card in your wallet with your name embossed on it. For the first time, you feel covered. Then, you use it. You go in for the thing you've been ignoring, and you brace for the system to catch you, and instead, you meet a word you didn't read closely when you signed up. Deductible. The several $1,000s you pay entirely yourself before the plan pays a cent, so you have insurance, and you still get a bill that empties the account. Covered turned out to mean something different than affordable. They were never the same word. You just assumed they were. The next time something feels wrong, you do the math before you do anything else. You weigh the pain against the deductible. And more often than you'd admit, the pain wins, and you stay home, and you wait, exactly like you did when you had no card at all. You ration your own care, not because a doctor told you to, because the bill is standing between you and the doctor and you flinch from it on your own. And even when you clear the deductible, the system isn't done. There's a second word waiting behind it. Coinsurance. Your share of the bill that keeps going after the deductible is met. A percentage of everything, so the meter never quite reaches 0. You keep paying a slice of a bill you thought your plan had finally taken over. At $40,000, you finally have the card. You're just afraid to use the thing you're paying for. Level 3, $90,000 a year. Something shifts. Care stops being a crisis and becomes a routine. The plan is better now. A real network. A deductible you can actually clear. A copay instead of a catastrophe. You go in early for the small thing, before it has a chance to become the big thing. You stop treating the doctor's office like a place you can't afford to enter. You get the checkup. You fill the prescription without doing arithmetic in the pharmacy line. The dread that used to sit behind every symptom quietly loosens. But there's a line in this system you can't see, and it's drawn in a place you'd never think to look. In network and out of network. You do everything right, you pick the hospital that's covered, and then a specialist you never chose, who happened to be in the room, turns out to be outside your network. And the bill for that one person arrives like a trapdoor under a floor you thought was solid. You're protected here. Mostly. The protection just has a seam, and the seam is exactly where you weren't looking, and the protection has a leash. The good plan is tied to the job, so the job and the coverage become the same decision. You want to leave, to start something, to take the offer across the country, and then you remember what walks out the door with you, and you stay. The plan that shields you also quietly holds you in place. At 90,000, you stop fearing the doctor. You start fearing the paperwork behind the doctor. Level 4. $250,000 a year. The bills still come. They just stop being threats. A surprise charge lands, the kind that would have detonated your life 2 levels ago, and you read it, and you pay it, and your week continues. Not because the system got cheaper, because you finally have enough room that its sharp edges don't reach you. There's a number on your plan you never used to get near, the out-of-pocket maximum, the ceiling on what you can be made to pay in a year. Down at the bottom, that ceiling might as well have been the sky. Up here, you can reach it and keep standing. The mail changes too. Glossy envelopes start arriving. Private practices, membership medicine, a doctor who promises to actually know your name. The system has noticed you can pay for more than the minimum, and it's begun to court you. You're not just insured anymore. You're insulated. The bill and the fear finally became two separate things, and choice opens up. You can get the second opinion without weighing what it costs. You can pick the specialist instead of taking whoever the system assigns, drive to the better hospital 2 cities over, say yes to the test you'd have talked yourself out of before. Money didn't buy you different medicine yet. It bought you the freedom to choose, and choice was never free down below. At $250,000, the bill still arrives. It just stops being something that can hurt you. Level 5. $1 million, plus you stop waiting rooms entirely. You pay a flat retainer once a year, and in exchange you skip the line the whole rest of the system stands in. Same-day appointments, a doctor who answers a text on a Saturday. No clipboard, no 40-minute wait past your appointment time, no fighting a phone tree to reach a human. You didn't buy better medicine, exactly. You bought out of the friction, the delays, the holds, the waiting. All the small frictions that ration everyone else's access quietly stop applying to you. When something feels off, you don't weigh it against a bill anymore. You just go, or someone comes to you. The gap between noticing a problem and getting it looked at shrinks from weeks to hours. The wait list that stretches for months for everyone else quietly collapses for you. A referral that would sit in a queue becomes a call your doctor makes personally, and a door opens that same week. You never see the line, because someone is paid to move you past it before you'd have even known it was there. The system that makes everyone else wait doesn't make you wait. That, it turns out, was always for sale. You just finally had the price. At $1 million, you stop being a patient in line. You become a client with an appointment. Level 6. $10 million. Your health stops being something you react to and becomes something that's managed. There's a team now, not a doctor, a team. People whose job is to look at you before anything is wrong, to catch the small thing while it's still small, to run the panel and read the scan and notice the pattern nobody would have caught if nobody had been paid to look. You don't chase appointments. Appointments are arranged around you. The best access the system can offer flows toward you before you've even asked for it. And the two things this system rations hardest, the two things everyone below you is quietly short on, are the exact two things you now have without limit. Time, because someone is watching so problems get found early, and access because no door in the building is closed to you. The same illness that sent the uninsured version of you to the most expensive door in a panic is, up here, a scheduled conversation on a Tuesday, and nothing falls through the cracks because there are no cracks left. The specialist talks to the primary who talks to the team, all of it coordinated by someone whose only job is to make sure your care is one conversation instead of 10 disconnected ones. Down at the bottom, you were the only thing holding your own care together, calling, chasing, translating one office to the next. Up here, someone is paid to carry that weight so you never feel it. At 10 million, you don't buy better health. You buy the time and the access that everyone below you was rationed, and those two things change everything. The loop. Somewhere right now, someone feels a pain on a Sunday and does the math instead of going in. They wait, because the door has a price, and by the time they can't wait anymore, the only door left is the most expensive one there is. The bill that follows is the highest number the system prints, handed to the person least able to pay it. And somewhere else, someone with a team and a retainer has the same thing caught early on a Tuesday in a quiet room for a flat fee they've already forgotten they paid. Same body, same illness, opposite experience. The difference wasn't the medicine. The medicine was the same. The difference was the number sitting next to their name, and everything that number quietly unlocked or quietly closed. Between them are all the versions in the middle. The one afraid to use the card they pay for. The one who stayed in a job just to keep the coverage. The one who got the trapdoor bill from a doctor they never chose. Every one of them was told they had access, and every one of them found out that access came in tiers, and theirs had a ceiling they could feel. The system isn't broken. It's doing exactly what it was built to do. It prices access, and it rations time, and it hands the biggest bill to the person with the smallest cushion, all the way up the ladder in perfect order. You are the same body at every income. The system just decides how fast, how much, and how gently based on what's next to your name. It was never about how sick you were. It was always about what you could pay to be seen.